Okay, then let me share. Okay. So feel free to stop me in the middle if you have any questions. Okay. So basically, I'm going to go over a few topics. One is basics of MI and components in MI, as well as hazards in MI associated with these different components, namely static magnetic field, IF pulses, as well as fast switching gradient field. And their hazards are mostly force for static magnetic field, heating for IF pulses, and the noise for fast switching gradient fields. And then I'm going to talk about some MR safety guidelines at CTRIM, mostly pertained to human imaging, and some emergency protocols. Okay, let's go to basics of MRI. So the nuclei spins, here are the elements that will provide option for us to do MRI imaging. Anything in yellow actually can be imaged. For example, proton, carbon, sodium, and phosphorus. And they are pretty much, other than carbon, everything is naturally abundant. An important parameter is geomagnetic ratio, gamma. That defines how fast these elements are going to precess in the magnetic field. And here I'm mostly going to focus on proton imaging because that's like 99% of the imaging that's being done here. So if you think about nuclear magnetic resonance, and all these magnetic nuclei are having this own little magnet in the absence of an external magnetic field. So all these protons are going to orient randomly. And as soon as you have an externally applied magnetic field, then these magnetic nuclei are going to be aligned with the applied magnetic field. It's going to have two states. One is parallel to the applied magnetic field. Another one will be anti-parallel to the main magnetic field. So let me close my office doors. Let's go. Okay. And something important is the Lamo frequency, and that's related to the geomagnetic ratio. If you remember, we showed in previous table. So depending on the geomagnetic ratio, as well as the main magnetic field, all these protons are going to precess or spinning at a Lamo frequency, omega. And then this omega changes with main magnetic field. So namely at 1 Tesla, 1.5 Tesla, or 3 Tesla, it's precessing at different frequencies. And that's important because that's also the frequency that we are receiving our signals at. So from a quantum mechanics approach, and again, it's not going to go to any quantum mechanic physics, but just very simplistically, these parallel protons and these anti-parallel protons are going to have different energy state. And if you think about it, just let's take an example of 2 million protons at 0 Tesla, namely no external field. They are actually going to split up as soon as there's an external magnetic field. And the higher or the stronger the magnetic field, the bigger the energy split there's going to be. And also, if you notice, out of that 2 million protons, these parallel versus anti-parallel protons are going to be roughly evenly split, except that you're always going to have a little bit more in this lower energy state, which is the parallel to the main magnetic field state. And the higher the field strength, you are going to get a little bit more of these excess protons. And because these little protons or these magnetic nuclei are having opposite polarities to each other, so you end up, your end up signal is actually coming from these excess protons. Because these 1 million, one is positive, one is negative, they just cancel each other. So only these excess protons that gives you MI signal. So, and they have this delta energy state. So the total magnetization or your signal strength is actually dependent on these excess protons. It looks very small. You only have 9 excess protons to be imaged out of 2 million, but there's actually a lot of hydrogen protons within brain tissues or brain any tissues, like even in mouse. So within 1 millimeter cubed tissue, you roughly have 10 to the 13 excess protons. So you still get a lot of signals to come from. But also be mindful that as you go to higher and higher field strength, there's a benefit of more excess protons and higher number of protons to give you MI signals. That's why you want to go to higher field strength for animal imaging, because animal imaging, the brain is so small. You want higher signal noise ratio to do higher spatial resolutions to see your images. So that's that 10 to the 13 is actually gives you the proton density weighting. So for example, in fluid CSF, then you'll have a lot more protons than in the bones. There will be less protons. So that's like an MI contrast that you're going to see. Other than the proton density, you are also going to see some image contrast, so-called T1 weighted imaging. And this T1 weighted imaging is governed by a T1 recovery curve. So different tissues will have different T1 time constant for signal recovery. That's why you can manipulate your imaging to emphasize on the T1 contrast. And this recovery is governed by this recovery curve, exponential curve. And it's the spin lattice relaxation. It's a process whereby energy is absorbed by the excited protons or spins when it's released back to the surrounding lattice. And there's another parameter that governs MI contrast called spin relaxation, which is the T2. So commonly you are going to hear MI imaging will be proton density weighted, T1 weighted, and T2 weighted. That just means that we are optimizing our imaging parameters so that you see the T1 signal difference or the proton density difference or the T2 differences. So you can see this is a T2 decay curve. It's time constant and it's tissue dependent. And you can see that, well, previously, the T1 contrast actually gives you gray and white matter contrast. Gray matter will appear gray and white matter will appear whiter. And in the T2 weighted images, you are going to see most differences from CSF and other brain tissues. So your CSF will appear very bright and your gray and white matter will appear darker, but it's not very clear differentiation between gray matter and white matter. And again, the MI imaging contrast is very versatile. That's why MI is so great for soft tissue contrast. You can manipulate your T1, T2 proton density and other imaging parameters. You can make imaging contrast look like all these different variations. And that's beyond the scope of this lecture. Okay, let's quickly jump to the components in MIs. So 3 main components in MI. One is, of course, the main magnet. It's the bulk of the construction of the MI. It's very heavy. It's the most cost related component. And it is the whole bulk. If you look at, can you see my cursor? Guys, girls?
Yeah, yes, you can.
Okay, good. So if you see here, this yellowish thing is the magnet. So you can see the whole housing because the main magnet is very, very heavy. So you also have this housing share there to support your main magnet. And then the second component is your radio frequency coils. So your radio frequency coils will be most closer to the human body, or sometimes you'll even have coils aligned on your body. And that is used to transmit and receive MI signals. So you want it to be as close as possible to your anatomy of interest. And then you have your gradient coils, and gradient coils are usually sandwiched between your radio coils, radio frequency coil, and the main magnet. And the gradient coils are used for spatial localization. So it's going to have these different colors. It's not going to have different colors, but it's illustrated in different colors just to show that you have X gradient to produce X spatial information, Y gradient to produce Y information, and the Z gradient to produce Z information so you can 3D spatially localize your signals. So let's get down a little bit more to the components. So the first one is the magnet, main magnet. So there are generally two kinds of constructions. A is the air core magnet. So the magnet field strength is going to be horizontal. Your B naught is going to be horizontal. And you have a lot of your magnetic field actually extends beyond inside of the ball and extends way outside. And then this is the outside of the main magnetic field is called the fringe fields. It extends way beyond the magnet itself. And you have the B is a solid core magnet. And in the solid core magnet, it's very much like your North Pole and South Pole. Like you have two magnets. And with this construction, the B naught, your main magnetic field, will point vertically. And in this construction, your fringe field is actually very well contained. You actually don't have a lot of fringe field outside of the main area. And pretty much all the superconducting MRIs are with construction of an L core magnet. Pretty much anything beyond 1 Tesla are going to be like the L core magnet, horizontal magnet. For the B construction, it's mostly for permanent MI. It's low field, for example, 0.5 Tesla or 0.3 Tesla. As you remember, we talked about it with lower field strength, you have less excess protons to skin for your imaging. So you are going to have a more grainier image, less signal noise ratio. So it's for better imaging, it's more preferable to get to higher field strength. Although nowadays, artificial intelligence algorithms are making low field strength more accessible and better image qualities. But I also want to remind you, which is very safety related concern, is your fringe field extends way beyond the volume of the cylinder. So that's everywhere outside of the MI, you still have magnetic field. And some important factors considering main magnetic field include like field strength, temporal stability, and field homogeneity. That's why it's so expensive to make this. And this shows an example for the MI superconducting construction. And so the MI, all this electricity, so the main magnetic field is actually created by electrical current. But if there is any resistance to the electric circuit, then you're going to lose power, right? So the concept in MI, in the superconducting, is you actually submerge all your electrical wires within liquid helium. So you see this blue area. This is for helium field and the cold head. So your coils is actually surrounded within this liquid helium. So in this liquid helium, which is cooled down to 4K, you are meeting the superconducting requirement. So as the MI coils and the main magnetic field are initially charged during installation, it doesn't lose power. It stays there, and you don't need any further electrical supplies to run it. So the MI is superconducting, and MI is always there. So a key point I want to bring you here is the magnet is always on. There's no power plug to plug it in and plug it out. After the initial installation, no electricity is needed to maintain the magnet. And the helium is getting pumped and circulating to cool this magnet. And the compressor is just going to make noise. And if you go to an MI room, you're going to hear that chirping sound. That's how helium is getting pumped into the MI to cool the magnet, the circuits to run the whole magnet. Okay, so now let's move on to the second component, which is the radio frequency coils. And the role of them is to transmit and receive MI signals. So if you remember our previous picture, this is another cartoon that shows you have, other than the IF transmitting coils, which is typically sitting inside the plastic construction of the MI. In order to improve signal receiving, you can have these receive-only coils, which can be your head coil or your body array coil that's aligned very close to the body, so that you can minimize the distance from your emitted MI signal to your receiving coils to improve your signal noise ratio. But whenever you do imaging, you actually, the first step of your image acquisition will be IF transmitting coils are going to exert a lot of the IF energy to the body to tip your protons to the transverse plane, and then you can start to manipulate your signal, and then they are getting received as MI signals from your receive coils. But with a lot of these transmitting energies, it's going to create heating issues. And we're going to go more detail later. So the third component is gradient coil. As I said, gradient coils produce spatial localization. So how does it do that? So imagine you have electrical current going opposite directions in two loops. So changing electrical field will create magnetic field. So in this counterclockwise and clockwise and counterclockwise current will create magnetic field, which is opposite to each other. So when you add these two magnetic field to each other, a very nice feature is within the small range of this orange range, you are actually getting you can create a linearly varying magnetic field. So if you still remember, we talked about this LAMO frequency, and that is the precessing frequency of this magnetic nuclei within the main magnetic field. So when you are adding onto it the main magnetic field, a linearly varying magnetic field, which is a small additional of magnetic field, what you are going to create are your protons or your magnet spins are going to have a slightly different precessing frequency along this direction, giving it X direction, Y direction, or Z direction. So when they have different frequency, spinning frequency, you will also get different phase. So this frequency and the phase are actually uniquely identifying where your spins are located along a certain direction. So that's why you need 3 directions, because X, Y, and Z directions, you can uniquely locate where the source is that's producing your signal, right? So now you have X gradient, which is will create a linearly varying field along the X direction. And then you have Y gradient, which will create linearly varying field in the Y direction. And then you have your Z gradient, which will create linearly varying gradient along the Z direction. So now if all your protons and all your spins have unique frequency and phase depending on where they are located spatially, now you can reconstruct your MRI images. So again, it's some additional details here. Well, the linear magnetic field is ideal, but when it goes beyond there, you could have distortions because it's not linear anymore, but all your MI signal encoding assumes linear signal. So you're going to have distortions and everything that's relevant. Or if you have metal that's affecting your field, you're going to have distortions. So that's again beyond the point of this safety lecture, but just know it's because it's spatially this frequency, this magnetic field, and frequency that all your protons are spinning at defines their spatial location. And your MRI imaging sequence are a series of events that we plan out. That's what imaging physicists' job is, program these imaging sequences and to program all these different events. And they are tightly time controlled so that you can manipulate the frequency and the phase of your protons and give the signal that you want. So you have X, Y, and a Z gradient, they turn on and off. Then you have your IF excitation that's being turned on very early on. And then you have your MI signal being collected when it's being encoded. So after encoding, your MI signal is actually in this so-called Fourier space that you will not know what you are imaging. But after Fourier transform, you actually get your brain image or any anatomical image for MRI. Okay, any questions so far? If not, let's quickly move on to the safety now. So the first hazard with MRI is the strong magnetic field, because with any strong magnetic field, you have strong force. The Earth magnetic field is very small. It's 0.5 Gauss. For modern scanners, we're talking about 1.5 Tesla or 3 Tesla, or in the animal scanner, we're talking about 7 Tesla. And 1 Tesla equals to 10,000 Gauss. So just think how strong it is. And our MRI at HSF3, the human MRIs are all 3 Tesla scanners, and the animal MRI scanner are 70 or 9 Tesla. So it's enormous magnetic field. So for the effect of this main magnetic field, they could induce magneto-hydrodynamic effects, which are actually reversible. Namely, if a person walks into the MRI, and if it starts to see the magnetic field could potentially increase the T wave in your ECG wave. And it's not much. It's It's 25 millivolts at 1.5 Tesla for peak flow in the aortic arc. And that is inside the scanner. So if you are only walking outside when the field drastically reduce, you are not going to see that much change. And the voltage induced is proportional to the field strength as well as the angle at which the flow is oriented in the magnetic field, of course. So, and there's no evidence that such voltage actually result in any ill effect. And at very high field of the order of 450 Teslas, it will be something required to alter nerve conduction, which we are way, way, way below there. And there's also a study that shown that prolonged exposure of both male and female rats to 9.4 Tesla has no effect on numbers of offsprings, growth rates, feeding patterns of blood and urine biochemistry and behavioral development. And prolonged occupational exposure for staff to static magnetic field is also unlikely to have any effect. So far, out of 30 years of MRI research, there's no evidence exists to support cumulative effects with time for static magnetic field exposure. There's still some laws per FDA for the static field exposure is for adult children and infants greater than 1 month, we need to limit to 8 Tesla. And neonates and infants less than 1 month, it will be less than 4 Tesla. And that is not to say for people who work around MI, it's to say who is going to go inside MI for an MI exam. So here shows the static magnetic field. What's the fringe field around it? So what is considered safe? So here is a picture of an MI scanner, and that's just a construction of the air core magnet. So in here, this is typically when you do MI construction, room construction, we will get these plots of equal magnetic field plots. So if you see here, the center of it is the MI. And then you can see the magnetic field is actually kind of like ellipsoidal surrounding the main magnetic field or the scanner. And it decreases pretty rapidly as you walk away from MI. And you can see this is the 3 millitest line, and this is the 1 millitest line, 0.5 millitest line, and 0.3 millitest line. So what is safe? We consider 0.5 millitesla line as a safe range, namely 5 Gauss. That is to say, when the MI room is being constructed, shielding will be placed around the MI room so that within the MI room, it will exceed 5 Gauss, not everywhere, but it could somewhere. But outside of the MI room, it will be safe. It will be nothing beyond 5 Gauss. For MI accidents, well, if you do a Google search, you are going to see all crazy images for things that's getting stuck to MI. And believe it or not, these accidents are still happening. And the latest fatality is in 2021, oxygen cylinder kills South Korean man in MI accident. He was killed when an oxygen cylinder was carried into the scanner suite during his exam, and the oxygen cylinder is just going to fly away to the MI. A more distant MI fatality is in 2018. In India, a man dies after being sucked into an MI machine while carrying again an oxygen cylinder. But this man did not die because the oxygen cylinder killed him, but he died because when the oxygen cylinder break and there is liquid oxygen leaked to there, and just by him inhaling this liquid oxygen caused his death. And some recent MRI incidents within the US, it's very recent, 2023, October, during a routine MRI at Simon Medical Technologies made a critical error. They allowed a prisoner wearing these metal shackles into the scanner room. So of course, its metal shackle is going to be sucked into the MRI and it just caused injury. There's another MRI crash in 2023.
Can you hear the freak accident at a Bay Area hospital, an MRI scan that went horribly wrong.
And now there are claims that lack of oversight is putting patients at risk. KTV's Brooke Soros investigates how life-saving equipment can become dangerous and life-threatening.
It was late February at Kaiser's Redwood City Medical Center, an ordinary day from the outside, but inside an MRI technician reported hearing screaming coming from the other room. This photo explains why. The hospital bed was pulled uncontrollably into the MRI machine by its magnetic force. A nurse became pinned between the bed and the machine, reports say. She suffered crushing injuries. The patient fell to the floor. The incident is detailed in a Cal OSHA investigation, including Kaiser failed to ensure the door to the MRI room remained closed and employees were following safety guidelines. The injured nurse recalling,
I was getting pushed by the bed. Basically, I was running backwards. If I didn't run, the bed would smash me underneath.
My first thoughts were, not again.
Tobias Gilk is an MRI safety expert whose own research using federal data shows as the number of scans and exams increases, so do accidents, but at 3 times the rate. Gilk estimates thousands of incidents go unreported every year.
Personally,
Yeah. For the time of the lecture, I will just end this and you can search for more. But so it is very dangerous. I'll show another example here. Just imagine that's a small oxygen tank. And imagine your head is this watermelon there. And that's a very small oxygen tank. There's another effect that if it doesn't suck into there, you could also have force induced on a conductive object, for example, aluminum. So the electrical current is generated within the material, a conductive material, and the current will interact with the magnetic field and generating this so-called Laplace force. See how hard it is to move this aluminum board there. So what could cause a problem, this torque force? There's another MI fatality, which is more distant in the past. A 74-year-old female patient was referred for MI scan, and the screening indicated that she had an aneurysm clip, but the type was wrong, not reported properly. So the patient actually getting scanned because it's thought to be safe. And then because of the torque of this aneurysm clip within the MI scanner, it just caused a severe hemorrhage and the patient just died. So because of the big danger of MI scanner, so we have strict zoning within MI suite. There are 4 kinds of zooms. Zoom 1, Zoom 2, Zoom 3, and Zoom 4. So Zoom 1 and Zoom 2 are safe, but Zoom 3 and Zoom 4 are dangerous, and it needs MI screening before we can allow people to go there. So Zoom 4 is strictly restricted. That's where MI is sitting. And Zoom 3 is typically the control room or the MI equipment room. And here just shows a typical MI facility. The room where your magnet MI is sitting is considered Zoom 4. It's a strictly forbidden area for anybody non-screened. That's why it's marked red here. And then you have Zoom 3. Zoom 3 will include a control room where staff will be doing their equipments, or the coordinator may be sitting there, and the MI technologists will be prescribing their scans. And the equipment room where all the MI hardware are there. And then the Zoom 2 are okay. That's like the waiting areas and patient changing rooms and corridors. That's where you do your checklist, MI screening, like reception, patient changing, and anything can be done here. But before you bring them to the control room, they should already have been screened. So ferromagnetic and metallic materials are just forbidden. The ferromagnetic materials examples include iron, steel, cobalt, nickel alloys. They will be strongly magnetized in the external magnetic field, and then there will be very, very strong force. And just mind you, this force will be proportional to the volume of the ferromagnetic material, as well as the local magnetic field. So our scanner are 3 Tesla or above, so the force is very, very strong. And also the larger the object, the stronger the pull. Even a key ring, you're going to feel very strong pull already. So these are like strictly no-no. So ferromagnetic objects should be restricted from entering Zoom 3. And if you are not sure, definitely talk to our technologist. We also have a handheld magnet, and you can borrow it, and that can be used for testing. You can use the handheld magnet around your object to see if it sucks. And always investigate and document device MI compatibilities and for safety information. We are very strict in terms of implants, as well as anything that could be metal in the subject. Because we are doing research MI, it's unlike clinical MI. Clinical MI, there is a lot of benefit for the patients. So you do it even if there is slight little of risk. But for research MI, there is no risk, no benefit to the patient. Your subject comes here just for a research MI, without any benefit. So there's really no risk that's tolerable. So potentially dangerous object here just shows a bunch of examples: oxygen tanks, patient beds, chairs, crash carts, linen carts, you can see here. And credit cards, don't bring it in there. It will get erased. And phones, it's probably not going to fly, but it may damage some parts of it. We have an eligibility checklist for MI. It's actually a front back, and here just shows the back of it, and that they have all these little questions about implant. And the front of it, I should include the front of it. It will ask you like age, weight, and if you have had MIs before, and if you have had any surgeries, because some people may not remember what implants they have. So we ask what kind of surgeries they have had before to imply what kind of implant or metal clips that they may have. And we also screen for pregnancy. So the MRI eligibility checklist should have been filled out way before the subject comes for MRI. You should screen them when you enroll them, because it makes no sense to screen anybody who are not MI safe for an MI exam, right? If that makes sense. And you can talk to me. We have a shorter summary for MRI that you can go through it with your patient if you are doing a phone screening. For example, you will be asking if you have any implanted devices. Usually knee and hip replacements are fine. All these orthopedic implants will be fine. But any other devices, you need to check with us further to determine what specific type and model. We need type and model, because then we can search for the device safety. Absolutely not criteria is no pacemakers, no cochlear implants, no stents of unknown type, and many stent types are fine, but we need to know what specific type. No severe claustrophobia, that's not implant, but if a subject is known that they have severe claustrophobia, and will freak out in a closed space, then it makes no sense to bring them, because you are going to be in a very confined space. And if you're doing MRI, you have a further confined helmet type MRI coil, head coil on you. So it's going to be a problematic thing. And also any prior eye injuries or foreign bodies in there. Because you may have, someone may be doing metal work, shielding work, or maybe in military, that they may have bullets or metal shred in their eyes, because any metal in eye, they can move, and that can create big danger. So in those kind of scenarios, we will need prior X-ray to confirm clearance of metal in the eye, or a doctor's note confirming objects has been removed. We cannot just do it as is. Even if the subject have had prior MIs and at another institution, they don't automatically qualify them for eligibility here. Again, because they may have had MIs at a lower field strength, then your force will be different. And also, if they have done clinical MIs, there may be slight risk there. It doesn't mean that they are safe for a research MI. I just want to further point out here, because we've turned away patients on the site because they are not MI safe. And then that's a waste of coordinator time, subject time, as well as MI scanner time and our technologist time. Also, for contact lenses, most contact lenses are fine for those corrective ones, but there's a special kind. It's the color contact lens, the circle contact lens. They are not MI safe. So just ask them to take it out. And again, you can contact me, and we have a quick screening checklist we can share with you for screening, and as well as the full MI checklist that you should screen way ahead of time before bringing your subjects. And for devices, it's a whole big range for MI safety. Again, there are 3 categories for implanted devices. They are either MI safe, because if they are totally non-metallic, or they are not MI safe. If they have ferromagnetic items, then they are just big no-no. But because of the popularity of MI, there are a whole big range of MI conditional devices. So these items will have none or negligible ferromagnetic items. They need to be further examined before entering Zone 4. So, and because new medical devices are constantly being introduced, so MI personnel must remain very vigilant in screening practices. And you should contact us if you are unsure about any implant, because we have a website to search for specific model and make. That's why for any implant, we will require make and model from an implant card or a surgical note, so that we can go to the make and model as well as implant date. Then we will search for that for the device safety. Okay, that's a lot about main magnetic field. So the other part will be quicker. So the IF pulses, the main issue is heating. So as I will remind you all, the radio frequency pulses are for transmitting and receive signals. So here shows a diagram how that's being done. So your IF pulses are being used to excite your protons. And before IF pulses, all your little protons will be spinning either parallel to the magnetic field or anti-parallel. So your net magnetization will be aligned with your main magnetic field, but that makes imaging harder because it's hard to see any signals in the existence of a strong main magnetic field. So what you need to do is you use IF pulses to excite, to turn your main magnetization to the transverse plane. And that's when you can receive your signal and you align your receiver in the transverse plane to receive all your transverse magnetization signal. So your MI signal is actually this transverse signal, which is a smaller magnetic field signal. But in order to tip these things down, you can imagine that's a lot of energy that's being deposited. And again, the bigger the anatomy, more protons there, you will need to have more IF energy to tip these things, right? So if you are doing a body scan, that's a lot more energy than if you're doing a wrist, because that's a very, very small amount of protons, well, relatively, for this IF pulse to work. So radio frequency pulses are mostly thermal effect. The IF pulses will deposit energy into the tissues. The larger the patient, the more energy is going to be there, because you are going to have more protons within this person to be excited. So there are some heat-sensitive tissues, for example, eyes and testes, and there's no evidence of deleterious effect, but you could have some sensation there. So this time-varying radio frequency magnetic field, because you are turning it on and off, right? And then these electrically conductive materials like leads, wires, implants, they could, when these electrically conductive materials when you have time-varying radio frequency pulse, you can cause conductive electricity within these leads or wires or implants. So monitoring leads can cause skin burns, looped wires or conductive materials can cause induced electrical voltage and currents. Again, that's going to cause heating or displacement of these wires or implants. And also clothes that may contain electrically conductive materials that will also cause heating or currents. Also, skin staples or superficial metallic sutures, they can also have heating, or they may have torque or trying to move. So here shows an example of MI burns from the tattoos. So this first-degree tattoo burn caused by an MRI machine, because you have a very large tattoo and with metallic ink, it's actually causing heating there. And then this is another example of IF burn from non-carbon electrodes. And nowadays, because people are more aware of the safety related to the main magnetic field, so pretty much 70% of reported MRI-related injuries are burns. Those IF energies are calculated with a parameter called SAR, specific absorption rate. And then this is proportional to your main magnetic field and the flip angle of your IF pulses used there, and TR and your weight. And then it depends on a lot of the MR imaging parameters. Just know that some of them are controllable, some of them are uncontrollable. And electrical current may be induced in conducting materials. These objects, for example, pulse oximetry sensors, cables, cardiorespiratory monitors. So that's why no unnecessary wires should be left in the room. We need to be careful with wires and nodes touching subject skins. And we also don't want any loops that's created by your human body, because human body is also conductive materials. For example, here shows some example of loops created by human bodies. So do not loop cables, and your leg and hands should not be crossed. And we also always use sheets to cover subjects, and we ask subjects to change to paper pants and clothes. That's just not to have their skin touching each other, to avoid loops. What to do with tattoos or wires for practically? So for tattoos, if a participant have excessive tattoos, especially those that seem to have metallic ink, you really need to alert us ahead of time so that we can assess the eligibility. For small tattoos, they are usually fine. We typically will just be mindful of it, and we will ask the patient to let us know if they feel any heating in them. Because if there's any heating or excessive heating, then we will pull them out of the MRI to not cause any burns. And then for wires or leads, and especially if we have new equipment, then you need to check this MR safety. Only MR safe wires and leads allowed, or you need to talk to our staff so that we can test it with you. Okay, now we move on to the third hazard, which is the fast switching gradient field. The hazard it will cause is, one is peripheral nerve stimulation, the other is loud noises. So this shows some example of gradient coils. So again, you have your magnet, your IF coils, and sandwiched in between will be your gradient coils. And your gradient coils are these a thin aligned metal sheath inside the scanner, and that's used to create spatially varying magnetic field. And the gradient coils, usually what matters will be so-called dB dt. So dB over dt is just how fast gradient change, the magnetic field changes over unit amount of time, how fast it's switching. And per Faraday's law of induction, rapid switching of gradient will induce electrical currents in conducting tissues. So this shows an example: changing electric field will cause electricity, will cause changing magnetic field, and then changing magnetic field will cause changing electrical current. So the scanners with echoplanar imaging capabilities, like commonly functional MRIs, diffusion MRIs, they actually have ability to generate currents that may exceed the nerve depolarization threshold and cause peripheral nerve stimulations. And theoretically, the possibility exists for stimulating cardiac muscles, which of course you don't want. You only excite cardiac muscles when you want to shock the person from near death, right? So this shows an example of gradient. So you will have fast switching gradient to a big amplitude and fast switching them down and switching them up. So this ramp time is just how much time you use to switch. And then this is just like how much amplitude you are switching your gradient. So this is the dB/dt, it's like the ramp of it. So it could stimulate motor nerves and skeletal muscles, and that's being experienced actually routinely by our subject. They will feel a nerve tingling with some sequences, and that's actually normal. And some subject may experience a harmless sensation of flashes of lights, and that's from the retinal stimulation by induced current, and that's also harmless. And this shows an example of dB/dt and just how fast this switches versus the ramp time, like time. And then you can see that the cardiac stimulation level is like way, way above here. And then scanner typically limits the switching of the gradient to within first level or second level peripheral nerve stimulation. So your subject may feel nerve stimulation, that's common, but it should not, routine clinical scanners should not create any harmful sensations. But that's not to say gradient coils are not going to cause any problems. The problem being the noise. If any of you have ever been there for an MRI exam, you should know that MRI exam can be really, really loud. Here shows an environmental noise level. If whisper quietly in the library is at 30 dB, then subway trains are at the sound level of 95 dB. Level at which sustained exposure may result in hearing loss is 19 to 95 dBs. And for 140 dB or 128 dB, you probably are starting to feel pain. And then 140 dB is even short-term exposure can cause permanent hearing damage. So that's something that you don't want your subject or even your staff to experience. And I just want to remind you, those EPI sequences, the loudest sequences from the scanner, it could be at the level of 120 or 140 dB. So what do? Well, of course, you give them hearing protections. System manufacturers must issue warnings on system console if a particular pulse sequence is likely to be beyond 99 dB. So 140 dB, as we said, it's going to cause acoustic trauma. So earplugs can offer 10 to 30 dB attenuation, and headphones is 10 to 30 dB attenuation. And in tandem, that can reduce noise by like 40 dB. So all patients, or if a staff needs to remain in Zoom 4, which is a scanner room, during imaging, we need to wear hair protections to protect them. Okay, so MRI safety guidance at here. One is for MRI healthcare workers. So you guys, after training, you are considered MRI personnel. So only trained and educated personnel in MRI safety, they can enter into and work within Zoom 4 independently. Like you resume the responsibility of your own safety. And you should obtain an MRI screening checklist with us, especially if you have had any surgeries or any implant in you. We can screen you and make sure that you are safe to enter MRI. and all non-MI personnel, which will include all your subjects and any visiting students or scholars that you bring to the MI suite. They must first pass an MI safety screening process before they can enter Zone 3. It's the same screening procedure as patients. And also janitorial staff, construction workers, people around here. If you bring anybody else, then you as the MI personnel, you will be fully aware of safety, and you should advocate in terms of MI safety. And you are like the advocacy of MI safety, and you actually need to be responsible for the MI safety for any person that you bring to the imaging floor. Our MI safety screening procedures, especially pertaining to human imaging, are 3 levels. There needs to be a written screening form, and you need to verbally screening your subjects and going through the checklist with them, make sure that they understand every item there. And then when you come to us, you need to bring this filled out MI checklist. And our MI technologists are going to go through the checklist with your patient again as a 3rd level of protection. And there are cases that our technologists will deem that something is insufficient and they cannot do MI, and then they will turn you guys away. That's why it's extremely important to contact us if there's anything uncertain on the MI checklist. And also, it's extremely important that you go through the checklist with your patient. You cannot assume that they understand every single question being asked on the checklist. Then something gets unscreened and leaked to us, and then we have to turn them away. And you definitely don't want to do that. For some other special considerations is pregnant women. So for healthcare workers, likely you guys who are staff working here, there's currently no limit to work in and around the MI scanner, but you should avoid being inside the MI scanner room when active scanning is going on. Like you should just be outside of the scanner room. For patient and subjects, pregnancy is typically an exclusion criteria for research studies. So that's usually not a question to be asked. For pediatric patients, there will be no toys or no unscreened comfort items entering Zone 4. All children will be gowned before entering Zone 4. Accompanying and the remaining adult should also be screened to enter Zone 3 and Zone 4 and offered hearing protections. And at CTRIM, all research subjects entering Zone 4 will need to be gowned. So they will need to change out their clothes and take away all their jewelries and rings and everything. So the best thing you can do is when you ask your subject to come for an MI, ask them to take away all jewelries, any piercings. Sometimes it can be really hard to remove and take excessive times. And also ask them to wear comfortable clothes, and they will need to change to gowns anyway here. Okay. We're getting very close to an end. So we talked about MI is always on, but there's something to turn it off, which is called a magnet quench. Magnet is always on. It can be powered off, but it's a very costly procedure. And that should only be done when there is personal injury emergencies. So if you come to the MI control room, you are going to see on the wall, there's some equipment there. And there, a red button is there. That's our quench button, and it's protected by a plastic cover for a good reason, because you don't want to accidentally to hit on it. So what happens with magnet quench? So when magnet quench happens, it's like an emergency off button. So the temperature of the superconducting wires will rise rapidly, because the only way to turn off MRI is to have the wires go out of the superconducting condition, and then the resistance will increase, and then your electrical current will reduce. And then over a period of time, all the electricity will be dissipated, and then your magnetic field will also be dissipated. So in these emergency cases, your temperature of your conducting wires will rise very, very rapidly. And because of that, your liquid helium will boil off very violently. There will be enormous volume of gas vented out of the magnet through a quench vent pipe, which typically goes to outside of the building, and it will cause large booming sound. However, if the quench vent pipe fails, for example, there's ice blockage or a bird decided to make a nest in there, potentially this gas could enter the scanner suite, and which can be dangerous if you remember the MI fatality from liquid oxygen. So this liquid oxygen resulting from the supercool air could increase fire hazard and could be hazardous to human. And there is $80,000 written there for quench. That's a very costly procedure. And with the inflation, that's like 5 years ago, the cost. So that's very, very costly. So this shows an example of quench. That's an intentional quench. That's when you decommission your MI, and if you want to have fun, then you do a quench and see what the quench button does, but you don't want to do that. And this is an uncontrolled.
It was supposed to be a routine equipment transfer at Peninsula Regional Medical Center. Technicians were to replace a used MRI, or magnetic resonance imaging unit, with a new one. But as workers stood nearby, the old machine blew up. Fortunately, no one was injured in the blast, but it did surprise everybody. Our own Hank Bounce.
Yeah, so that could be dangerous as well. So what do you do in terms of magnet quench? If a magnet quench happens, there will be rapid reduction of magnetic field in about 2 minutes. There will be loud noise, hissing sound. You need to evacuate the Zoom 4 immediately. You need to close the scanner room door. And you need to assist so that no responding fire or rescue personnel will be allowed in Zone 3 and Zone 4 until confirmation that the field has successfully dissipated. And you guys, is important for you guys as well, although we have personnel here, it's whenever personnel injury is happening, that's an emergency situation. So everybody will be very busy because we're going to need to call 911, and we need to secure the patient and get the patient out of the scanner room. So you guys, as assisting staff around the MI area, you will actually resume the responsibility of assisting our staff to ensure that the MI area is safe. No additional personnel should enter, and the scanner door should be closed. So if it is not patient safety, but equipment got sucked into the MI, and you do not need to quench the magnet, there's a much better procedure to be done that it's called ramping down the magnet, because we can gradually dissipate electricity and make the magnet to ramp down in like an hour, 2 hours of time, then there will be no damage to the hardware. And that's like something that we should do if it's only equipment danger. One more emergency situation is emergency shutdown. So if you are in the MRI scanner room, not the control room, and you take an observation on the walls, you're going to see another plastic covered button, which is an emergency power off button. So for emergency power off, the use is to shut all power supplies to the scanner, all electronics related. And that is, again, the MRI does not need power. So that will be any accessory powers. For example, the equipment room that supplies gradient power, IF power, and anything else. And also the scanner host where you do your imaging and archive your images. So that computer will also be shut off by your emergency power off. So that is to be done in case of fire in the equipment room, or there's water leak in the equipment room, or potential fire hazardous situations. But instead of pressing that button, you should really just shut down the scanner. And that's much better than you just do this emergency power off button. It's kind of like you shut down your computer versus you press that big button to power off your computer, okay? Then anything, if it's not being saved, it can be saved. But that's in emergency situations. So it is not quench again. So the magnetic field is still present. So you need to follow proper procedures. Okay, again, in case of emergency, you need to stop scan first. You need to remove patient or participant from the MRI room. You need to quench the magnet if the patient or participant is in danger. Or you emergency shut down the magnet in fire or water or in any other hazardous emergency situations. Then you need to lock the MRI scanner door and keep it closed and evacuate. Okay, we are going to an end. So summary, MRI environment can be very dangerous. There is static magnetic field, there's force, missile effect, there is time varying radio frequency magnetic field, mostly it's a thermal effect, and time varying gradient magnetic field, it's mostly nerve stimulation and noise. So we need to follow strict MI zoning guidelines, restricted access to zone 3 and zone 4, and we need to be very vigilant on MI screening checklist. And also never bring anybody to the magnetic room unless they have been cleared by our technologist, and never bring any equipment or devices into the MI room unless you have consulted with our MI personnel, because you're going to damage things. Okay, so for any questions, feel free to consult us. We are always here. You can come downstairs, or you can call us, or you can shoot me an email. We will find answers for you. And we are very, very vigilant in terms of subject safety. Okay, let me end. How can I end the recording? Let me stop sharing. Pause share. Stop share. And how do I end the recording?